Before you blame aging, this silent circulation problem may be causing cold toes and aching calves. Most people feel cold toes and aching calves and tell themselves the same story. It must be age, maybe poor flexibility, maybe standing too much, maybe just circulation in that vague way people say it when they do not really know what they mean. And that is exactly why this problem gets missed. Because sometimes the real issue is not aging by itself. Sometimes it is a specific blood flow disorder called peripheral artery disease, or PAD, where narrowed leg arteries reduce blood flow to the legs and feet. PAD is common, especially in older adults, and it is caused most often by atherosclerotic plaque buildup in the arteries. The medically honest version of this title is more specific than the dramatic hook. Cold toes and aching calves do not automatically mean PAD, but they fit PAD well enough that they should not be brushed off as just getting older, especially when the calf discomfort shows up with walking and eases with rest. NHLBI says the most common symptom of PAD is intermittent claudication, which is pain, aching, heaviness or cramping in the legs that comes with walking or climbing stairs and goes away after rest. The pain is often in the calf. NHLBI and Mayo also note that one foot may feel colder than the other and that the legs or feet may not get enough blood flow to keep up with demand. And this is where the story gets more interesting. PAD is called a silent circulation problem for a reason. A lot of people do not have the classic textbook pattern. Some have atypical symptoms. Some have almost none. The 2024 AHA/ACC PAD guideline describes asymptomatic PAD as one of the recognized clinical subsets, and research reviews note that many patients are either asymptomatic or have symptoms that do not sound dramatic enough to trigger concern. That is one reason people can have reduced blood flow in the legs for a long time before anyone names it. So if you want the practical takeaway early, here it is. If your toes feel unusually cold, your calves ache or cramp with walking, your feet change color, your leg hair or toenails seem to grow less, or your symptoms improve when you stop and rest, PAD belongs on the list. It is not the only explanation, but it is one of the most important ones because PAD is not just a leg problem. NHLBI research materials and the AHA both stress that PAD is a manifestation of atherosclerosis and is linked to a higher risk of heart attack and stroke. This is where people get fooled. They think circulation problems should feel dramatic all the time. But PAD often behaves like a supply and demand problem. At rest, blood flow may be just enough to keep things quiet. Once you walk, climb stairs, or ask the muscles to work harder, demand rises and the narrowed artery cannot keep up. That is why calf pain with exertion matters so much. It is not random soreness. It is a pattern. Mayo, NHLBI, and the AHA all describe leg pain during activity as the classic symptom of lower extremity PAD. And the cold toes part matters too. NHLBI specifically notes that one foot may feel colder than the other, and the affected foot or leg may become pale, discolored or blue. That is not something people should casually file under "my feet just run cold." It is one of the quieter ways poor arterial blood flow can show up, especially when it is paired with exertional leg discomfort or slower healing foot issues. Most people also underestimate who is at risk. Age alone raises PAD risk. But the big drivers are things like smoking, diabetes, and high cholesterol. The AHA says age increases the risk of PAD, while smoking and diabetes are especially important modifiable risk factors. NHLBI research pages and smoking guidance say smoking and diabetes are major PAD risks, and smoking raises the risk even more when other cardiovascular risks are already present. That is why this title matters so much for older adults. If someone is over 60, has ever smoked, has diabetes or pre-diabetes, has high blood pressure or high cholesterol, and now notices cold toes or aching calves, the threshold for thinking about PAD should be much lower. The AHA even says that if you have PAD risk factors, you should be screened even if you do not have symptoms. That is a big statement, and it tells you how seriously the condition is taken now. This is also why people often mislabel PAD as an orthopedic problem. They think the calves hurt because they are tight. They think the feet are cold because of the weather. They think the walking limitation is simply deconditioning. But Mayo's professional update puts it well. Leg pain and leg cramps are not always an orthopedic issue. Sometimes they are a serious blood flow issue. And because PAD affects the arteries that supply the legs and feet, the symptoms can look deceptively local even though the disease is vascular and systemic. The next part most people never hear is that PAD can stay deceptively functional until it is not. At first it may just mean you walk slower, stop sooner, or avoid hills. Then maybe one foot stays colder. Then maybe a small sore on a toe takes too long to heal. Then HLBI says PAD can lead to chronic poor blood flow in the leg, with complications including pain at rest, sores, infections, and tissue loss. Cleveland Clinic's chronic limb-threatening ischemia page describes rest pain, wounds, and gangrene as advanced warning signs of severely reduced blood flow. That sounds severe, but that is the point. PAD is one of those diseases where early recognition matters because the later stages are much harder and more dangerous. The 2024 AHA/ACC guideline says PAD is associated with increased risks of amputation, myocardial infarction, stroke, and death, along with worse walking performance and quality of life. So when a person says, "My toes are cold and my calves ache, but I assumed it was age," that is exactly the kind of sentence that should slow everybody down. Now here is where the hopeful part comes in. PAD is not something you are supposed to diagnose from a YouTube-style script, but it is something clinicians can often detect with the right history, exam, and a simple test called the Ankle Brachial Index, or ABI. The AHA and NHOBI both say diagnosis commonly relies on the history, physical examination, and resting ankle brachial index. Mayo also notes that weak or missing pulses in the affected area can be clues on exam. And this is why the silent circulation problem phrase actually fits. Many people will never say, "I think I have artery narrowing in my legs." They will say, "My calves hurt when I walk," or "My feet are always cold," or "I cannot walk as far as I used to," or "My shoes feel fine but my toes never warm up." The condition hides behind ordinary complaints. That is what makes it dangerous. I also want to be careful about one thing. Not every cold foot or calf ache is PAD. Neuropathy, venous problems, musculoskeletal strain, spinal stenosis, and simple cold sensitivity can also cause leg symptoms. But what makes PAD stand out is the pattern. Symptoms linked to exertion, relief with rest, a colder foot, color change, weak pulses or wounds that heal poorly. Those are the clues that push the story away from just aging and towards something vascular. And if the symptoms are sudden, severe, or come with a dramatic color change, numbness, or severe pain, that becomes even more urgent. Cleveland Clinic says, acute limb ischemia is a sudden drop in blood flow that threatens the limb and needs immediate treatment. That is not the typical slow PAD story, but it is exactly why sudden worsening leg circulation symptoms should not be minimized. So if I had to reduce this whole script to one line, it would be this. Before you blame aging, understand that cold toes and aching calves may be your body's quieter way of warning you that the arteries feeding your legs are not delivering blood the way they should. And if that is PAD, catching it early matters for much more than your feet. It matters for your walking, your limbs, your heart, and your brain.